I'm joined by Tori Wason, Patient Access Director at Banner Health. Tori's joining a panel discussion at the upcoming Patient Financial Services meeting on a session related to eligibility verification and prior authorization. Tori, thanks so much for coming on today. To get started, could you tell us a little bit about your professional background and how you got your start in the healthcare industry?
Yeah, absolutely. Thank you for having me. So I started healthcare in 2004. My grandfather was actually a radiologist, and I went back to work for the company that he had been one of the original members of, but he had since retired from. At that time, I was not sure what I wanted to do, but I started with various roles in cash posting, reimbursement, and some accounts payable finance. In 2008, I had the opportunity to transition into human resources. And so I did, and I was the HR director for about 8 years. I loved what I did and helping the team members, but I decided that I wanted to also have more of an impact on the patients. And so I moved into revenue cycle in 2016. Throughout my journey in revenue cycle, I've overseen cash posters, eligibility, authorization, and financial clearance, and I've been heavily involved with the front desk. So I've worked in outpatient radiology and am passionate about patient access, and that is where I am today.
Terrific. And tell us a little bit more. So you're a patient access director at Banner Imaging. Tell us a little bit about some of your priorities at the moment and kind of what you're looking forward to into the next year, into 2024.
Yeah, so like you said, I am a patient access director for Banner Imaging, which is our freestanding radiology clinic. So we're at Banner Health. And authorization is always a challenge. I think I hear that from healthcare peers all over. So our focus has been really on those authorization denials and write-offs, but balancing, making sure those patients have access to care. And what we can do to secure those auths for those patients, and working with the insurance team and the referring providers on how we can better get these patients that access to care without having those denials or write-offs. And then we also are looking at continuous improvement around automation to help decrease those denials, and then also looking at our coordination of benefit denials and eligibility denials to really try to impact that rework that happens on the back end and how we can improve those processes.
Well, certainly we hear all the time that prior authorization is really up there in terms of the challenges and the denials as well, which really leads into the panel that you're joining, which focuses on several components. So ensuring we've got the eligibility verification and the prior authorization all ready to go to generate that clean claim. Tell us something you're looking forward to discussing or benchmarking with the panelists during that upcoming session.
Yeah, so I'm really excited about this upcoming session and being able to hear from other healthcare partners in the industry and some of their challenges that they're having around authorization and eligibility, and any tools or processes that they've put in place to increase their clean claim rate. I'm really hoping that this will just be some, interactive work between us where we can share those ideas, and maybe something comes up that we haven't tried and we can see, where we can implement and put in place at our facilities as well. I'm also looking forward to learning from others that are outside outpatient radiology. That's where I've spent my career. And so I'm always looking to learn more about other areas in acute and ambulatory as well.
Terrific. It's always so nice to hear from different organizations, even working in different parts of the country, what they're doing and how they're battling these tough challenges that you're all facing. We really look forward to the meeting coming up in November, and thank you so much for coming on today and sharing a little bit about your background with us.
Absolutely. Thank you so much.